You asked me the question, what's the best in the past 40 years? It's right now, honestly. I mean, I love talking to new patients. I love taking a history. I love helping patients, and they love being heard because they've been to other physicians that aren't able to help. They've been, or a lot of patients have already been through allergy testing and they haven't gleaned any, symptom-free. They don't feel better. It's not doing anything. So I love that aspect of it. And, I'm literally, I just love helping the practices. And I've found a couple of niches over the years of physicians. The group that I'm helping now are integrated medicine practices, and they're so grateful, because they're able to help patients, and it's helping patients with their total wellness, not just about a runny, sneezy nose. It's about inflammation. It's about, gut issues with food allergy. I mean, so it's overall health. And this is just one more way to help the patient feel better.
Welcome to today's vendor spotlight. Today we have Diana Kelley. She is the leading expert in allergies. So she's going to be telling us about herself, about her company, how she serves practices all over the country. So Diana, welcome to today. Thanks for being here.
Thank you. And I want to start off by saying you're calling me an allergy expert, but I'm not an allergist. So I'm not a doctor. I've had lots of doctors on my staff over the years, and I've kind of been grandfathered in because I've been doing this for over 40 years. The way that I got started was that my dad actually was an otolaryngologist who started teaching a course called How to Do It at the American Academy of Otolaryngology Allergy, which is the Ear, Nose, and Throat Academy. And so he actually taught me everything I know. He's still alive, but he actually was instrumental in helping us get our CME accreditation. So for 20 years, we actually taught an allergy course, How to Do It, and offered continuing medical education and had our own ACCME accreditation, the only allergy company out there that does have CME accreditation. So I've kind of followed in his footsteps. We developed a turnkey system, and we follow practice parameters from the Academy, the American Academy of Otolaryngology Allergy and the American Academy of Asthma, Allergy, and Immunology.
Well, I mean, that sounds like, you have a lot of experience coming from a child and then obviously taking it on, further. I think I read your bio. You had started a different company, you had sold the company, and then you started your allergy CME company. So tell us a little bit about that. Like, what were the biggest challenges that you were seeing in the industry? And then why did you start that company after selling your first one?
Right. So when I got started, right out of college, I went to work for a Swedish company that doing allergy testing, and actually it's now owned by Thermo Fisher, and they still have the technology is basically the same. LabCorp and Quest both use that technology. And I did that for 10 years. And then I started my own lab, got to be the largest allergy laboratory in the country. We sold that to LabCorp. And then, so all this time, we actually had a separate CME program. So we had doctors come to us pretty monthly, somewhere in the country. We had meetings that were usually weekend meetings. And long story short, doctors started calling saying, hey, can you come physically train me instead of us coming to your meeting? We'll pay you more to come train us so that we don't sit in a didactic kind of CME course listening about how to do it. Let's actually do it. So that kind of transformation, led to allergy treatment systems and allergy continuing medical education. And then the pandemic hit. And when the pandemic hit, doctors, I couldn't go to them anymore. So we started doing Zoom, and we started doing everything that we could to help physicians without physically being there. And that works. But the best way is to physically be there. So right now I'm out almost every single week going somewhere in the country to a practice for hands-on training for 3 days. We will have a live CME activity at the end of the year, for those physicians that just want to come and get their CME. But the best approach is hands-on, having me there for 3 days to train as many of your staff as you want and as many as your providers. Our turnkey system is all about documentation. It's all about, if it's an insurance game. I mean, I've learned today a couple of other commercial insurance companies are moving towards Medicare, Medicaid policy. And you absolutely do not want to mess with the government. So we don't, we do everything on the up and up. We don't try to, we don't try to bill more than we should. We don't try to mix treatment sets more than we should. When I go to a doctor's office, I teach them how to do prick testing and how to treat off of those results. Insurance still believes that prick testing is the gold standard. LabCorp and Quest do an IgE blood test. So you can do both. Insurance will pay for both. And then there's a company that does a finger stick. And so we can do prick testing and a finger stick, and insurance will pay for that once a year. We can then mix treatment sets for the whole year for the patient based on the results. Now, I'll show you an example because these are my treatment sets. So I'm allergic. I've never taken allergy shots in my life. And all of a sudden, I started having acute allergic rhinitis. It would not stop. And so I did a finger stick because I drink a ton of vitamin C every day. I usually take a Benadryl if I need to try to get to sleep. And all of that affects the skin test. So we can do a finger stick or a blood draw and get the same results, if not better, than the skin prick test. Although, like I said, insurance still feels like skin prick test is the gold standard. But based on those results, we mixed 3 treatment sets. So 3 shots a week is what I'm taking. So we mix the strongest and we dilute it down and we start on the weakest vial. So I take 1 shot a week from each one of these sets. And this lasts all year. So I'm starting my 3rd vial and I'm already seeing results. So the point of allergy treatment is allergy is an inflammation disease. Inflammation is the root of all evil. So literally it's helping, I run 5 miles every day. It's helping my knees, my joints, and my back. And I can tell the difference. My nose has basically quit running. If I eat too many of the foods that I'm allergic to, then my nose might start running again. But seasonally, the allergy shots are really helping. So that's what we're teaching. There are some allergy compound pharmacies out there. The reason that we're successful is because we are teaching you to do this in-house. So this would cost you under $50 to mix. A compound pharmacy charges $500 to $700 to mix. So it's a big difference, and it's another way to maximize additional income in your practice, as well as truly help your patients.
So you mentioned like you go to the doctor's office and you train everybody and you're there for 3 days with them?
Correct.
What can they expect on those 3 days to go through training with you?
So if you go on our website, allergycme.com, you will see the itinerary. Okay. We basically start the first day. This is the itinerary and you'll see it on the website, but I'll just tell you, we start by, if we can see 15 patients while I'm there to test and to treat, which that's our goal, they can make their investment back on all the supplies and having me come there to train them. So we start by having patients go off meds for 2 weeks and come in and get tested, skin tested. If they can't go off their meds, then we can do the finger stick, but they get skin tested. And so usually Monday afternoon and Tuesday morning, we spend doing testing on patients. And it's the same thing over and over and over. But the neat thing about it is it's a different patient every time. And so when you take an allergy history on a patient, which we take the history, we don't have the patient fill out the history. When you take an allergy history on the patient and fill out their test sheet, the neat thing about the history is that it literally matches the test sheet. You can do a history on a patient, and when you get through looking at their skin prick test, you're like, wow, the results match the history. So it's kind of neat. And it's bonding time with the patient. And allergy patients, they're going to come to your office once a week for a shot, or they can take the shots home. They can even do drops if they want to. However, Medicare or Medicaid does not recognize drops because they're not FDA cleared. So do not give drops to a Medicare patient. Don't even try to get away with it. But for the most patients coming in once a week for their shots, you develop a relationship with them. In most practices, they're there once a week anyway, and so it's just a natural offer to the patients. It's way less expensive for the patient than to go to an allergist. Now, I will say allergists are immunologists, and they understand the immune system better than the ENT guys, and they push the patient to try to maximize, to have them symptom-free as quickly as possible. And so they're going to have reactions. They're going to have, hopefully not anaphylactic reactions, but they're going to cause reactions to happen. The way that we're teaching is half as fast. It's the ENT method, and it's all about safety because we don't want the patient to have any horrible reaction. If the patient is beyond the practice realm, if the patient has had an anaphylactic reaction, then we say, we don't need to do testing on you. We need to refer you to an allergist. So the ENT Academy and the Allergy Academy formed a joint task force for primary physicians because 1 in 4 Americans has an allergy, and there's only 3,500 allergists in the country. There's not enough help for allergy patients. And so they formed this joint task force to enable a primary practice to follow parameters to allow for allergy testing and treatment. And that's what we're doing.
That's amazing. That's awesome. Now, I know that we talked before, and I want to make sure that everybody knows what makes your approach different from maybe other people that are doing the same or similar type of training that you may be doing.
It's the education and the 40 years worth of experience. And so I'm very clear with everybody that I am not a doctor, but I have doctors to this day that call me on a regular basis, doctors that I've been dealing with for 20 years that call me on a regular basis and will say, what should I do about this? Well, I'm not a doctor. I can't tell you what to do with your patient. I haven't seen your patient. However, in all the hundreds of practices that I've trained over the years, I can tell you what the norm is. And so, and if I don't know the answer, then I'll go to my medical staff and find out, what their answer is. So our medical director, and who used to be my dad, he's not anymore because of his age. But anyway, the information and the education gleaned from my training is superior to any other allergy company out there.
And then do you guys also provide training talked about, there's a lot of billing and coding and things that go along with this. What kind of things do you do in your company to support the practitioners that are maybe looking to implement the allergies into their practice?
So like I said, Allergy only has 4 CPT codes. Primary CPT codes. And so I work with the billers to make sure that they understand, because every insurance company is different. Every insurance company allows a different number of units or doses. So this would represent 60 doses, but Medicare says that 1 ml is a dose. There's no doctor in the whole country that gives a 1 ml shot for an allergy shot, but that's what Medicare says. So that's what we have to follow. So for a commercial company, insurance company, this is 60 shots. But for Medicare, it only represents, even though it is 60 shots, we can only bill 30 shots for Medicare, if that makes sense, because they say 1 ml, and these are 5 ml vials. So they're saying you only get 5 shots out of this vial, when in fact you get 10, because the patient is not taking a full ml. They start at 0.05 cc's, which is a teeny little bit, you know, but following insurance guidelines is most important. I just found out today that United is changing their policy. They're following more Medicare policy. You know, it's okay because we can mix this so inexpensively that, you know, you're not looking at, used to be you'd say, okay, if I do 10 patients a week, I'll add a couple $1 million to my practice. I mean, realistically, it's half of that, which is still substantial. It's still substantial. So insurance still pays very well for allergy testing and for allergy treatment.
And so if somebody wanted to implement this into their practice, what are some of the things that you're looking for in like the ideal client to help them? Do they already have to have something somewhat established? Okay, if they're new? So
I have an initial evaluation, and I ask the practice, start passing these out to every single patient that walks in your door, whether they're there for allergy or not. This will give you an idea of if they're a candidate for allergy testing. And so this piece of documentation is actually signed by the provider and serves as the first piece of documentation to show an insurance company this patient may have allergy. That's why we're testing them. And so it kind of goes from there. Now, most practices will hand those out to every one of their patients, and they'll go through their whole entire patient database in the first year of patients that need to be tested and patients that go on treatment. And then we have to depend on their new patients to come in. But after that 1 year, I mean, there's so many practices in rural cities around the country that have no allergist. You know, all the healthcare systems in the country, it's not the same as it was even 20 years ago, much less 25 years ago, because healthcare systems now are buying out practices. And so, you know, an allergist, for example, is probably in with a healthcare system and will have satellite offices and go 1 day a week here and 1 day. So having a primary doctor or a primary practice in a rural area offer allergy is huge, because the word gets out, patients are starting to be symptom-free quicker, and, you know, and they'll start seeing patients. And the big thing is the patient, if they have insurance, they don't pay anything. If they don't have insurance, the cost is very low. So, you know, we're able to help more patients, and that 1 in 4 allergy patients that doesn't even know he has an allergy that's causing a lot of other problems in their health, we're able to help that.
Well, it sounds like you have the turnkey system, right? You have the training, you have the continuing education, you have all the knowledge throughout your career. I would like to ask, you know, what's been the most rewarding part of your journey in this industry?
So it's kind of funny because I've been in this industry a long, long time. One of the few that's still out there. I mean, I can tell you all the people that started there's only 3 extract companies now, and I can tell you who started those extract companies. I'm able to get best pricing because I have a consortium. So anybody that I train, I authorize the extract company to give them my 85% discount. So, you know, so the practice is dealing with the extract companies for their supplies directly. I am not I'm not the middleman. I'm only training, and I'm only helping educate, but I'm keeping up with what's going on in the world of allergy. And so I'm able to help, you know, on an ongoing basis. I'm able to help with what the academy or what the parameters say to do.
Awesome. Well, here's what's the good news. The good news is that Diana is going to be doing a webinar for us next week. So if you're looking to add allergies into your practice, if you have questions about adding this type of service into your practice, Diana is going to be hosting. She's going to be our expert talking about allergies, how you can add this into your practice. So next week, February 19th, 10 a.m. Pacific Standard Time, she will be here with us. So we invite you to join us. And Diana, is there any final words that you'd like to say to our audience?
Well, the fun thing, you asked me the question, what's the best in the past 40 years? It's right now, honestly. I mean, I love talking to new patients. I love taking a history. I love helping patients, and they love being heard because they've been to other physicians that aren't able to help. They've been, or a lot of patients have already been through allergy testing and they haven't gleaned any, symptom free. They don't feel better. It's not doing anything. So I love that aspect of it. And, I'm literally, I just love helping the practices. And I've found a couple of niches over the years of physicians. The group that I'm helping now are integrated medicine practices, and they're so grateful, because they're able to help patients, and it's helping patients with their total wellness, not just about a runny, sneezy nose. It's about inflammation. It's about, gut issues with food allergy. I mean, so it's overall health, and this is just one more way to help the patient feel better.
Awesome. Well, thank you so much for being here today and for sharing your background, your journey, and the products that you bring to the marketplace. So we're looking forward to seeing you next week and having you on with us and our practitioners as well. So thank you very much, Diana. Appreciate it.
Well, thank you. Thanks very much.